I'm Dr. Connie. I'm your host of Mind Your Health podcast. I share my unique perspective both as a practitioner and a patient battling autoimmune condition for over 25 years because I had to figure things out on my own, and my education in my practical approach as a patient allows me to truly integrate it so that you can be whole and the burden of sick care is no longer your own burden to carry. And this is what we help you with in this podcast. Okay, do you see that?
I do.
Welcome to Mind Your Health podcast. This is Dr. Connie, and today I'm so excited to interview one of the most, I don't know if I can call her a protege, she's our yoga teacher that started as a yoga teacher at Functional Yoga Medicine Center in Swanee, but it quickly grew into something so much more, and she's going to share all about her experience with the program that she's in. We'll talk more about the Functional Yoga Medicine certification, but more importantly, I want Christina to share with you guys why she's choosing this path, aside from being a nurse full-time in the ICU and what caused her to transition. So you're going to get to know our amazing Christina Scholarless, and the theme of today's conversation is all about manifesting your dreams with functional yoga medicine, because she's been she's been manifesting everything that's coming into her life. And she's been so diligent, so committed. And I've never had anybody sort of surpass her level of commitment and discipline for the practice. So welcome, Christina.
Thank you. Thank you for having me. I'm so excited.
So first I want you to share your experience and background as an ICU nurse. What were the significant stressors or challenges that made you feel like something was missing in your career?
Well, it's funny the way things turned out, because when I decided to become a nurse and I went into nursing school, it was a very rigorous program, and I was fully invested, elbows deep into my work. I made so many sacrifices while I was in nursing school to make sure I was the best at what I could be. And I had so many dreams and aspirations for becoming a nurse. And I had this vision, and this was pre-COVID. I graduated in 2019. So as we all know, right at the end of 2019, that's when the whole world shut down and everything changed. So while I was in nursing school and we were doing our clinicals, one of the areas that really resonated with me the most was the ICU. And we did our clinical rotations in the ICU, and just watching the way these nurses were with their patients and that one-on-one, and having the complexity of that kind of a patient, and given all these opportunities to learn everything you can about the human body and how critical things can get really quick. It was something that I felt so drawn to, and I was like, I want to be part of this environment. I want to make a change. So I graduated in May of 2019, and fast forward to 2020, and there was a dire need for nurses. So I was like, yes,
COVID happened.
Right. This is my opportunity to really get in there and make a change. And my opportunity came to me right at the end of the first wave. And this was back in New York. So the first wave in New York was horrendous. There was a lot of PTSD that came about among the nurses during that first wave. And as a baby nurse, I'm learning about all these medications like propofol and all these really critical drugs. And I'm like, I can't even wrap my head around this right now. And you're telling me that if there's another wave, you're going to leave. So I was caught in this position where I was like, what am I getting myself into right now? And then I ended up relocating to Georgia to be close to my family. And a big part of it was to get away from the chaos in New York, right? So I moved down to Georgia, and I think by then, this was right before the third wave. And through that progression from the beginning to that point, I was noticing a pattern, and the nurses were becoming more and more burnt out, and they took less care of themselves, and there was a lot of burden being placed on us. And it really started to make me question about my path. So I started to kind of reconsider things, and I was like, do I want to continue down this path at the bedside, or should I escalate this to become a nurse practitioner? Because that's what they all do, right? It just seems like the right thing to do. You become a nurse at the bedside, then you move on to nurse practitioner. And then I started applying to nurse practitioner programs, and there was a little piece inside of me in my gut that was like, this isn't for you. Pull out while you still can, you know? And I would apply to these programs, they'd accept me, and I'd be like, wait, no. And I draw back. And it made me really reconsider everything. And I was like, no, I just think it's not so much about what the job is. It's about the job itself as a whole and what the expectations are. And then I started to really evaluate everything. And that pattern that I was noticing in the beginning started to affect me personally. And I was noticing the sacrifices I was making in nursing school were tenfold as a nurse. And I started noticing changes in my face. I was burning out, constant migraines, constant anxiety. I started getting palpitations before going to work.
Wow.
I wasn't eating properly. So it came to a point where I was like, something's got to give, because I'm only 3.5 years into this. And at the time I was 37. I'm like, something has to change. This isn't aligned with me. It doesn't feel right. I'm not living my true purpose. And I was taking home a lot of that work, watching people die every day, taking on that burden. But even more so, we weren't doing right by them. And I kept seeing this repeated pattern that we would just give them a sheet of paper and say, you have diabetes? Here, take this home, go change your diet. And then expect that to be the solution to everything. And it really wasn't, because we'd see that same patient 3 weeks later, and that problem that they originally came to us with came back tenfold.
So you felt like the system itself wasn't giving the solutions to the patient.
It's broken. It's a broken system. And it pains me to say that, because there's so much dependency on the system. And I think in a way we've created that dependency. I don't see much focus on prevention. I see more focus on fix the problem right now, fix the symptoms, and then...
So it's more acute care focus as opposed to long-term health.
Exactly. And what I can't even knock, the hospital for being there, because for critical emergencies, life-saving emergencies, great. That's a good resource to have. But when it comes to chronic conditions, we're really not doing right by these people. And I just keep seeing the same, I would get a new admission and I would see the same things.
Can I just say something, Christina? When you say the system itself is wrong and we need to do something. So tell me what you think about this, because the way I've been approaching it as a healthcare practitioner is I feel like it's a system that creates dependency for the patients to look to us for all the answers. But then also too, it's also a system that allows us as healthcare practitioners to feel like we're responsible for that.
Right.
You know what I mean?
Absolutely.
And so there's a disconnect between what they are. Every individual that comes for your care comes for my care, what they expect is a complete, like, solve their problems. But when in reality, you and I talk about this all the time, is we need to teach the right skills to teach the people, the populace, the world, how to manage their own body. And
Right.
really it comes down to really leveling up and owning their own health.
Yeah.
What do you say to that?
Absolutely. I mean, I would get 30-year-old patients who would come in totally abled, and they would call me in to cover their feet with their blanket. That's the level of dependency that we get. And it places a lot on the nurses. And it's, we become a nurse because we care. We want to take care of other people. So a lot of the times we're like, okay, I'll cover your feet with the blanket because we feel like that's what we need to do. But at the end of the day, we're only enabling that behavior. And what does that patient learn when they go back home? Absolutely nothing.
Yeah.
They know that, I'll just take my pain medication. And if something happens, I'll go back to the hospital and they'll take care of me. And that's placed such a burden on the healthcare system, especially nurses, because when you get those repeat admissions and nurses are burning out, we lost a lot of nurses during the COVID pandemic because of the burnout. They said, I'm done. I'm retiring early, or I'm pursuing other avenues because I can't do this to myself or my family. So then you end up with the problem where you're understaffed all the time, and you have these nurses who are coming in because they genuinely care, and they have more patients than they can take on because people don't want to take responsibility for their own health.
You know what? It's really scary. I've been in the hospital many times, and we talk about this. Just some of them are excellent. Some of them really care. And then there's others that just don't. They're just,
and the difference too.
Yeah.
You know the difference between the nurses who really care. They deep down in their core. I know some really amazing nurses where to their core, that's what they're meant to be. And then you see the other ones who are just there for the paycheck. It's a great paycheck. You get great benefits. You get all your time off. It's wonderful. But with that, I've seen some pretty horrific outcomes, and it's scary being a patient and even somebody who works alongside that to be.
Coming back to you a little bit, sorry to cut you off, but I just want to say, you strike me as somebody who is so caring, and I think you demonstrate that every day that you work at functional yoga medicine. Mm-hmm. The level of care that you put into each class, each patient, each module that you're training through. I just want to ask you, you have to leave a stable, respected career in healthcare with a stable job. I witnessed you just say goodbye to that and decided to own your own future and take the leap of faith. And I always tell you, I've mentored a lot of students in dietetics, physical therapy, and in yoga, Pilates, and I haven't seen anybody who really keep to their word, and you demonstrate this. And I just witnessed you blossoming into this amazing practitioner that I am so honored to lead and mentor. So speak to me about how you got over the fear of jumping ship.
When I did make that decision to jump ship, I thought it was going to be a lot worse than what it ended up feeling like. I was in the ICU environment in one hospital, and the burnout was just really taking over me. And I said, maybe I just need to change my environment. Maybe I'll feel different. And I changed my environment, and I noticed that the feelings were the same. I would get anxiety about going into the parking lot and parking my car and walking in, and the palpitations started. And it was about 2 weeks in, and I woke up one morning, I said, I'm done. I have to do this for me, for my health. And I pulled out my computer and I wrote out my resignation letter, and I said, thank you for the opportunity, but this isn't aligned with me. And they were very understanding. And that was a scary transition because I went a week without having any work. And I was like, you know what? It's either all or nothing. I got to go full force into this and just put faith that the universe has my back and that everything will always work out the way it's supposed to. And it was scary for a second, but once I sent that email, it felt so right. And then I went to pursue a different avenue of nursing while I was completing my my education for my yoga teacher training. And I knew deep down in my heart that I really wanted to be a yoga teacher, and I wanted to pursue my avenue in holistic health. And I've always had an interest in holistic medicine, but I never had the tools to allow me to make that happen. So I was kind of like, it'll come to me when it's right, when the time is right, it'll come to me. And it did. And I just got that feeling where it was like, you're on the right path. And it wasn't scary.
Okay.
It wasn't scary at all.
My next question then is, what were the reactions of those around you, your family, friends, colleagues, when you told them about your decision to pursue FYMCP?
So I had a lot of support. I really did. At first, there was always the question of, well, you are giving up a really stable career here. You are making, X amount of money each month, and you have your benefits and everything. Are you sure this is what you want to do? And I said, absolutely. There is no question about it. And I had a conversation with one of my best friends the other day on the phone, and she had mentioned to me, like, would you go back into nursing? I said, absolutely not. You cannot pay me enough money to go back into that environment. Knowing what I know now and experiencing this path, I can never go back to that, because this is not only in line with my true self, but I can sleep at night knowing that I'm doing right by others by helping them take accountability in prevention and take responsibility for their health to prevent going into the hospital every 3 weeks, month.
So you're doing the exact opposite of what you're doing in the hospital.
Absolutely. And, you would see these readmissions, and, I was one of those patients. When I was in nursing school, I had some severe neck pain, and months in, I couldn't figure it out. I changed my pillow. I was doing all these things, and I'm like, this neck pain is killing me. So I finally went to the doctor, and they said, do some yoga. Okay. What else? Can you help me here? And that's all. They gave me a piece of paper that said yoga. Okay. Is that all? Okay. We'll follow up with you in 6 months or something. Did I go do yoga that day? No, I didn't. And that was and this was before I even pursued yoga or anything, but that was just an example, or I guess a force getting myself involved in. And now I can proudly say with much confidence, each one of my students and my private clients that I talk to on a personal basis, they are so invested in their health. And there's nothing more rewarding than that, because I know I've had this discussion with many people before, and they keep saying, oh, I don't have the money for this. I don't have the money for that. And I always say, it's better to invest in your health than in medical bills, because those ICU bills, that will haunt you for the rest of your life. Yeah. And paying, whatever it is for your health, whole foods, going to yoga class, going to hot yoga, that's something you really can't put a price on, because, finances aside, you feel amazing. You have so much energy. And I just could not imagine myself being that guy who goes home and pops 15 different medications every day as part of my routine and is barely independent. And that's scary.
Yeah. Yeah. So I really commend you for taking the step to really help, because one of the things you demonstrate a lot from witnessing, because I deal with a lot of people, is that you really do care from the inside out. And I've seen you do privates with your clients as well as to teach. And I really feel like your learning curve has been like so fast. And I tell you this all the time. I want to ask you, what was the thing? I had this very unplanned conversation. And I just kind of let you know what my vision was. And I told you about the program, and I kind of left you to decide on your own. There was no pressure. I just felt right about your energy, I would have to say, because it wasn't in my plans either. But what made you be attracted and decide? Because I think one of the things you've kind of said to me was, I feel good about this. I feel like this is what I'm meant to do. So explain a little bit, what was the thing that drew you?
It was a gut feeling. You know, as I mentioned, when I was applying to nurse practitioner schools, there was always that little doubt that was like, do you really see yourself doing this for the rest of your life? Do you really see yourself going into debt with all these student loans and doing this for your career? And there was always that little voice in my head that said, no, I don't see myself being the one to live that life. And it was really just a confirmation that that wasn't part of my path. It wasn't something that I believed in. And once I found functional yoga medicine and I really started to immerse myself in the culture, it felt so right. Everything was falling into place. There was no shed of doubt. There was no questioning. It was just like, I'm in. It was just a feeling that I had, and knowing that this is something I've been interested in for years and years. It was like I was given this opportunity, and there was a part of me that's like, take it. Don't miss out on this, because this is your future. And when something feels so aligned with you, there's no other option but to just go with it and just put full faith that it's going to work out.
Well, that says a lot about you, because you're like one of the most positive people that I know. I want to ask you, how did the program or the journey in the program, because you're very neck deep in the program, how did it help you to rediscover the passion and give you the confidence to manifest the life you've always wanted? Because I know we talk about this all the time. You're en route. You're on your way.
Yep. As I've been going through the program and everything, I've noticed there's a common denominator, and each module or each topic that we learn or teach is something that I can personally resonate with. And it's not only been a reflection of what I can do for others, but it's helped me along my own spiritual journey as well. You know, for example, talking about the chakra system, starting off with the root chakra. At the time that I was studying the root chakra, I was going through something really deep within my personal life that was very transformative for me. And then that was a real awakening for me. And then as I continued through the program, each step was like, oh, wait, this is in line with me too. And then I realized that it's also helping me grow professionally, personally, spiritually. And it's held such a strong value in my life that I just feel not just passionate about it, but I'm eager to show others that if it's had this kind of an impact on me, it can definitely have an impact on others as well. And I want to be a part of that. And I think that's just driving my manifestations, because I believe in it. And if you want to, and this is something that I learned from you, is that whatever words you put out into the universe or whatever thoughts you put out, whether you know it or not, that's what you're manifesting. And you really have to believe it to your core. And if there's ever been any doubt, chances are you're going to put that out there. And for the functional yoga medicine program, I'm like, there's no shed of doubt. Like, I've turned down other opportunities because that's how much I believe in it. And I think that alone, the universe is listening and is like, here you go. You got it. This is what you wanted.
Let me ask you, what have you gained from shifting all this in such a short amount of time? Because, I mean, we talk about this, right? You left and you said no to many other opportunities. And then you just went head deep into the program. There was no guarantee. And today, I think you've kind of gotten so many opportunities and then it keeps coming your way.
Yeah, absolutely. I've gained, it's opportunity. It's a chance for growth. It's a chance for helping other people in the way I envision myself helping others. I didn't see myself spending my whole life at the bedside. That's not how I envision myself helping others. I think this is the way for me to help others. And I find so much satisfaction in that it just confirms everything for me. And on a spiritual level, I feel like I've evolved so much that I don't even recognize the person I was when I was in the hospital. Like, I look back and I'm like, who was that girl? I don't even know. And that just shows like I wasn't staying true to myself. I was following a path I thought I had to because society says, oh, you're a nurse, it's so respected. You're going to have so many opportunities. Yeah, you have opportunities, but it has to be in line with who you are. Otherwise, you're only lying to yourself.
Yeah, that's so true. So tell me, because you have several clients that you're overseeing their care right now, and it's something you've never done, treating person one-on-one as a nurse. Did the program like really help you to be able to help them in the real way? Because you have very distinct clientele.
Right.
And you adjust and apply the knowledge. Was that easy to do?
It did kind of come naturally, I think. And being able to connect with others is something that I love. I love learning about people and, just getting to know people on a personal level. And I think developing that strong rapport from the beginning gives you an opportunity to just connect with other people and learn really what it is that they need and not just what they want. I mean, it's easy to say, yeah, I want to look good. But it's another thing to say, I want to be able to wake up in the morning and not feel like crap. Like, I want to feel good. And I want to be able to bend over and tie my shoes without being out of breath. It's like, okay, I got you. I can help you with that. That's easy. We can work together. And just seeing their faces change is so rewarding. And I've had some amazing opportunities with clients and getting to know each of them and how similar but different they are and what they bring to my life. And it's been life altering for me too.
Let's not dismiss what you're doing for them. One in particular, we won't mention any names.
Right.
But I know he's completely changed his whole life and diabetes free, medication free.
Yes.
Weight loss check.
Yeah.
Touch the toes where he couldn't before. And hats off to you because you took that patient from 0 to now. He's such a blessing in our lives. Really talk about this.
He really is. And I tell him that all the time. And I even mentioned this to him too. I said, the first day I met you, you are a completely different person. I just remember you walking in the door and your energy was so different. And I said, look at you today. And he's like, well, it's all to you. And I said, no, you're doing the work. I'm just the messenger. It's up to you to take control of your life and to do what you need to do outside of our sessions. And just seeing how much he's grown. And if he hears this, which I'm sure he will,
It's drastic reversal of the symptoms he was experiencing.
Oh,
but what's so
100%.
unique about this gentleman is he wanted this. He asked for it, and he is so disciplined.
He is.
And don't we love that? But here's something that I want to ask you, Christina.
Mm-hmm.
I think we talk a lot about the underpinnings of why people get sick.
Mm-hmm.
And I think I teach you guys that it's really not the symptoms per se, but it's years of the person living with this body, failed to listen to the body.
Mm-hmm.
And so it's gone haywire. And then what do? We end up in the hospital or at the doctor's office, and we expect them to figure it out. And I think I focus a lot in mentoring you guys in saying, it's not our job to get them well. It's our job to guide them there.
Right.
That we can only do and meet them halfway.
Mm-hmm.
It's like that saying, we can only take the horse to the water, but you've got to drink that water.
Exactly. And I see that. I saw that all the time in the hospital. It was the complete opposite.
Yeah.
And, what we do at functional yoga medicine is so different because we give our clients the opportunity to really be vulnerable and work with that vulnerability and give them the opportunity to shine through it. And I think a really big part of working with our private clients is seeing that evolution and seeing them do the work. And you should see me when I meet up with them at our next session. I'll say, did you do your homework? And they said, I did. And I notice it because they're stronger each time. And I literally jump for joy and clap my hands every single time because it's such a rewarding feeling to work with people who want to do the work. That just shows that they're taking control of their life. And there's nothing more empowering than that. And I think as a society, we have become so accustomed to living with our chronic illnesses that it starts to become
the way of life.
And you don't even know that it's a problem. People live with pain for so long that they don't even realize it's pain, that when you remove that pain, they're like, oh, this is how I'm supposed to feel. And it's like, yeah, you've been living with this pain for so long. And now you have to, backtrack to the root cause. And I think that's the problem with our healthcare system is there is no focus on the root cause. It's let's fix your pain. Here's some pain medication.
Well, here's another thing that I want to say is as a physical therapist in the hospital setting and as a nurse, about the physical therapy arena. It's an ancillary service. And as somebody who's trained in physical therapy, I always tell you guys, there's a gap in the physical therapy system because everything is in the system. When it's in the system, we can only do so much.
Right.
Like if somebody comes in for cervical neck pain, and they might have a wrist pain. Well, we have to understand that it's related. You understand that now. Cervical radiculopathy is going to affect the whole limb,
right?
Because that's how the nerves travel. But the way the system's set up is if the patient comes in for the neck, well, that's one case. And then we have to do another case for the wrist. And so the same patient needing the same treatment, I can't treat both. And I always tell you guys, as I'm training you, this is what people need. Right. Is somebody to holistically tie all the dots together. Absolutely. That you guys can be a lot more effective. Let's fill the gap of what the clients need. And so I just want to emphasize that those with chronic pain and they want to manage their pain, not only manage, but thrive and get rid of pain, as well as those who are in recovery because of an injury, or those with chronic illnesses that the practitioner or yoga teacher or yoga practitioner may not necessarily know the contraindications. I feel confident that our functional yoga medicine certification program provides you with that knowledge and the confidence to deal and adapt to the needs of the clients. What do you say to that?
Well, being that client once upon a time, as I mentioned during nursing school, I had that severe neck pain. And, they just turned me away and said, do some yoga. I'll see you in 6 months. When I really pushed for it and I really said, no, you guys need to look into this, because I was 35 years old or whatever. I said, this is a problem. It's really interfering with my life. And, living with that for months and months, it was, you can't sleep. You can't even turn your head. And it started to really affect me. And then sure enough, I got MRIs done because I really pushed for it. And I was really at myself because no one else was. So, with MRIs and some blood work and testing, turns out they say you have arthritis. So, okay, so what's the solution here? And eventually, my knee, I ended up getting bursitis on my knee, and they removed the fluid and they tested the fluid. Their answer was lifetime steroid injections. I said, absolutely not. I am not doing that. You are not going to inject me for the rest of my life with steroid my immune system during a pandemic, and I'm just going to end up hating my life. Absolutely not. And now fast forward to I'm 38, going to be 39 soon. I feel better than I ever have. And that's with my yoga practice. My neck pain is gone. I took prednisone for a short period of time just to fix it in the moment. But since I've stayed consistent with my yoga practice, my arthritis pain is nearly gone. And that's just to prove that, yeah, I've been in your shoes before. I've lived with pain. There's a way around it where you don't have to take medication. Just take control of your life. Do the work. It's an hour a day, however many days a week. And it's not even just, oh, I'm going to go to yoga to, get rid of my pain. There's so many other benefits from it. You feel amazing. Your energy is so much better. And if there's anything that I can say to them is that I've been in your shoes before. I've been that patient or that client. And once I made that executive decision in my life to take control of it, that's when my whole life changed and my whole perspective and my vision changed. And it's been nothing but for the better.
So with that being said, I do want to emphasize you worked at other yoga studios. Mm-hmm. And I know that, I approach yoga very differently. Mm-hmm. Because I think a lot of people think it's the flexible and the outcome is the final expression of that pose. So crank that neck, crank that back, just get in there and just course yourself. And I tell you guys the importance of mindfully activating the proper muscles, not the external muscles that you see, but it's usually the stabilizers that lies beneath the surface that needs to be tightened. Bolts need to be tightened for you to have the strong foundation. So I think you now know how different you practice yoga now versus how you were practicing. So can you speak to that?
So it was one of the first yoga studios, if I look back to my first yoga studio ever, which was years and years ago, I hated it. I hated my first session. And I think a lot of it had to do with the teacher and the way that they were teaching it. I just didn't feel inclined to pursue it or continue that practice. And then sure enough, I went through a life-altering experience in my life. And I said, you know what, let me try this again. And I tried it, and it was a completely different approach. And it was with a completely different teacher. And that teacher is now a really good friend of mine. And it changed how I viewed yoga. Now, fast forward to, working and teaching and practicing at functional yoga medicine, I see how different it is. And the approach is even more different than I could have ever imagined. And I think a lot of that has to do with the physical therapy foundation that's behind it. And sometimes, I talk to my clients and they say things like, well, I'm wondering how it looks. And I said, it's not how it looks. It's how does it feel? You don't want to feel pain because you're going into the full expression. That defeats the whole purpose. And that's how people end up injuring themselves and never come back. The importance is to feel it, feel the right activation of your muscles, and then build on that. And incorporating that into my private sessions, my private clients can tell you that the next day I get text messages and phone calls from them saying, Christina, I'm so sore. And I'm like, because you're using muscles you haven't used before. And these are clients who have, been longtime runners, running for 25 years or playing tennis for a long time. And they're the ones telling me, I was so sore after our session. And that's just confirmation that, yeah, because you're doing the right thing.
Yeah. And then I feel like you too, in your own physical body, which I love so much about you as a practitioner, is that you're not only behind the scenes, like teaching, but you're a student, like in classes, taking classes and learning all the time. And as a result, we joked even yesterday how amazing you looked. I made a comment to you about how ripped you're getting and like so strong in your practice from when you started to now at functional yoga medicine. So talk about that.
So well, first I'll start off by saying that even as a teacher, you never stop being a student. Even just in life, you never stop being a student. There's always something new to learn from everybody, because we've all shared a different walk of life. We all have our own experiences, some more than others, depending on your background. And there's always a little piece of information, whether it be a word or just something that they do, and it triggers something in you, and it starts that, learning process towards, something you never even deemed possible. And that's how you really open yourself to growing. Now, as far as my own growth, I thrive in it, and knowing that I'm on this path, I'm going to fully immerse myself, because I want my students to know that I'm not just preaching it to you. I'm going to walk the walk. If I can come this far, so can you. And it's such a good feeling, because I want them to know too that I'm not just going to be the type of teacher that's going to walk in, teach you, and walk out. I'm going to do the practice with you, because we're going to be students together. And this is the outcome. And I still have such a long way to go, but I'm here for the journey. It's all the journey. And, the physical aspect is, just a small part of it. And I know I can get in my head about it. As most women do, we're so tied into our image and everything, but the reality is it's a journey, and we might want the instant gratification, but there is, you have to learn to be patient with yourself and just enjoy the process. And the outcome is the outcome. And I couldn't be happier with how far I've come now, because I feel stronger than ever. And being able to look in the mirror and feel that confidence in myself once again, I can't put a price on that. And I started to lose that part of myself while I was working in the hospital. I was gaining weight. I was pale. I wasn't eating well. My pants were getting tighter. And I'm like, no, something's wrong. I gotta do something about this. And now it's the polar opposite. Now I'm sweating every day, eating better, drinking more water, getting sun, doing all the things that are right by me. And I get to be that representation for my students and be like, here, this is possible for you too.
Which I think is the most powerful, because you and I both know, most of the healthcare practitioners, I was like that too in the hospital, in the system, because we're taught to hide behind our lab coats and just tell our patients in theory what they should do. Right. When in fact, we don't make logical decisions. Everything we do, like you, when you are stressed out, do you make good choices? No, but you know what to do.
Right.
We don't make logical choices. So I think all in all, the program really teaches you how to, number one, optimize everyone's enteric nervous system, which is their gut, number one. Number two, we help them regulate their autonomic nervous system. And then number three is we enhance their somatic nervous system, which is their musculoskeletal system, their body in motion. And then fourth, lastly, we empower their psychology through every session that Christina and any of our functional yoga medicine certified individuals are treating our patients, that's what they do at the end of it. But we do that through the practice of yoga.
Right.
Get in there. Can you speak to that? Like how you do that?
Yeah, for sure. I just feel like yoga is tied into so many different avenues. It's the common denominator. And, yoga isn't just about doing the poses. It connects you, like, for example, for your gut health, there's so much benefit into incorporating yoga into bettering your gut. It's so much as doing a twist.
Yeah.
You're really working on that gut, massaging your gut, and that helps create that flow, that regularity. When your gut is healthy, your brain is healthy. When your brain is healthy, the rest of your body is healthy. You got all your hormones and all the things that are they all start to level out. And then I think a really important one coming from a nurse is cortisol. We get so stressed. And then we're just on that constant high alert all the time, especially working in the ICU. You 1 minute, everything can be fine. The next minute, not so much. So you're on that fight or flight response. And that ties into your blood sugars. And then that ties into everything else, so on and so forth, which affects your gut and then affects your brain. It's all tied together. So incorporating the yoga aspect, it really connects the dots. And it connects the somatic. So you got your muscles moving, you got the enteric, you got the empowerment. There's not one avenue of that is missed with yoga.
Do you feel like the training provides you with a comprehensive outlook in how to connect the dots?
For sure, because I feel like it's easy to say in theory, but once you immerse yourself in it, it just becomes second nature. And you're like, oh, that makes sense.
Yeah, the application.
Absolutely.
So what advice would you give healthcare practitioners or other people that are on the fence about the program and they don't quite know what it is, and they feel burnt out, but they're afraid to make a career change? What would you, what's your advice for them?
Do it. Do it. If any of my friends can tell you, as much as I've changed my mind about careers in the past, while I was trying to find myself, speaking from that perspective, for once in my life, I can say this is a sure thing. And I could not be more proud of myself for the decision that I made. And it's a hard decision, especially in today's world. It's hard to survive. And taking a leap of faith like that, you really have to trust in the process. I just have to say, if there's any doubts in what you're doing, that is your answer alone, because you shouldn't doubt your path. There should be no question about it. If you're doubting the path you're on, then chances are it's not meant for you.
Are you loving doing what you do now?
I do. It's for once in my life, I wake up in the morning and me, I wake up at 4 a.m. and I hustle to the studio, leaving my house at 5 a.m.
Happily.
Happily. Exactly. I wake up and I'm happy and I'm so willing to do it. I just couldn't be more grateful for the opportunity to do that, or to even be granted that kind of opportunity to wake up and love what you do. It's not every day you hear that.
Well, Christina, I just want to say you're changing lives every day. And I think you finally feel like you're doing and making a difference. And it's just been a pleasure to watch you. And I know you're on Instagram. Can you just let the listeners know where they can find you on Instagram?
So you guys can find me on the Hermit Yogi. I try to be as active promoting. I'm so happy to promote functional yoga medicine because, like I said, I believe in it so much.
So can I just stop you for a second?
Yeah.
Why do you call yourself the Hermit Yogi again?
So I'm a hermit, and despite being somewhat of a social butterfly at the studio. When I'm at home, I'm very introverted, and anybody who knows me personally knows that I'm obsessed with my dog, and he's my world. And I can just go home and spend the night on the couch with my baby boy watching a movie, and I'm perfectly happy doing that. And I'm a very introspective person, and I like to reflect a lot. I've come a long way in my life, and I've had a lot of life experience, and just reflecting on where I am today, despite what's happened in my past, I wouldn't change any of that. And a lot of that came with that introspection and taking that time for myself and honoring that time for myself to allow myself to grow. And, you know, sometimes that has to be done in solitude, and that's okay. One big lesson, I think, is being okay in your own skin and being comfortable with yourself. And I think everything else just falls into place, because at the end of the day, it's just you. And I've learned that as part of my spiritual journey, that every decision I've made has been nothing but for the better of myself and my future, and taking every opportunity to learn that and grow from that. And I think that comes from being a hermit. There's a lot of reflection in being a hermit. So yeah, pretty much in short words.
So Christina Scarlett has or is taking new clients, and you can bet that she's going to give you 110% of what your needs are. She pushes and she leads and she directs and she guides you and she assists you both mentally, emotionally, as well as physically. She'll get you to in those poses and help you to activate the proper muscles and help you to really optimize your enteric nervous system, regulate your autonomic, enhance your somatic, and empower your psychology so you keep going. And so this is a skill that you develop over time. So if you're not happy with your physical therapy, you know you've got to do something about it. You need some guidance. You need functional medicine. This is the place to be. Here she's taking new clients. So please follow her on @Hermit Yogi, as well as just a little bit of a promo for the Tranquil Trio. We have events every month. It's the most amazing trio, and I'll let her kind of explain what that is. But please also remember to speak about how often we have the Tranquil Trio to come out to do the workshops.
For sure. So the Tranquil Trio has been such an amazing journey, and I work with some very talented and passionate practitioners. Brooke, who is a Kundalini teacher and our sound therapist. She is my friend that I spoke of. She was once my yoga teacher who changed my whole outlook on yoga. And she is just, I constantly learn from her every day. She is very spiritual and has so much knowledge to bring to the table. She's been a very strong addition to our trio. And then you have Chrissy, who is such a go-getter. She's doing Reiki, she's making sourdough, she's always putting herself out there. And I just have to say, on a side note, I could not be more thankful to have met these amazing people.
I've attended one of your Tranquil Trio experiences, and they put out the most amazing experience that if you're wanting to heal emotional trauma, mental trauma, or chronic illness, it is so therapeutic. And these three ladies put out, or these three yogis put out the most amazing, excuse me.
Bless you.
The most amazing experience that is going to really transform you from the inside out. So look out for that. They also have an Instagram page, the @Tranquil Trio. And then I believe they also have a website.
We do. We have a website. We have a YouTube channel as well. So basically, I lead our students through the yin poses, and then Brooke, she hosts a beautiful sound journey. And then Chrissy gives some very healing Reiki energy to all of our students. And we've had such an amazing turnout, very positive responses from our students and people who crave and want more. They're like, when's your next workshop? So we hold our workshops at Functional Yoga Medicine every 2 months. Our next one is on Sunday, October 20th. And it's been our base. And I see that students are responding really well to it because I think
changing lives. I think it's right in alignment with everything that you stand for.
Yeah, for sure.
Final words for those of them who are thinking about a new program like Functional Yoga Medicine certification. Any words to them to say about this opportunity?
If there's any doubt about your own path, I'd say consider a new one. And if you really want to make a change in people's lives for the better and do right by your patient, taking the time to invest in functional yoga medicine and learning about prevention is the best route to take, because that's what's really going to help them. And obviously, I can talk about this for hours and days because I have so much experience to share. And if anyone needs to just vent to me or ask me questions, I'm always available, because I want others to know that I've been on this journey and I took that leap of faith. And although it was scary at first, I don't regret a single decision I made embarking on this new journey, because I know I'm doing right. And I think on a collective scale, there's a lot of healing that needs to be done. And it all starts with yoga. It starts with our spirituality and wanting to make the necessary change for the better to make everybody feel better as a whole.
So this is a movement, I would say, and it's a collective movement. We talk about this community. It's better than and bigger than any one of us alone. We want to change the world, make this a world a better place by really sharing the peace, love, and joy that we can have in ourselves first and foremost. And we feel strongly as a community that it all starts with you. And we do it through yoga, and which is the common denominator of all things that we do, because it's the ultimate journey that brings you back home, which is right here. So I thank you so much for your time, Christina. This was amazing. And again, you can follow her at Hermit Yogi, and you can find her in the practitioners section of my website, functionalyogamedicine.com. And this video and recording will be available. It'll be tagged, and Christine will have it eventually when this airs, so that she can always have it in her bio, in her Instagram as well. So thank you so much, Christina.
Thank you. Thank you for having me.
I'll see you tomorrow.
Yes, absolutely.
Bye, everyone.
Thank you.
Thank you for listening to the Mind Your Health podcast. If you enjoyed the episode, we would so much love it and appreciate it if you share it with someone who could benefit as well as to subscribe to this podcast on Apple Podcasts, Spotify, or anywhere else where podcasts are found. And leave us a review. We would be so grateful, and it helps us to reach more people just like you, so you can become more empowered to enjoy longevity and health. You can follow me on TikTok, Instagram, and YouTube at Dr. Connie Chung. And of course, you can subscribe to this podcast for a new episode every single week.